Hi friends, myself Dr. Ankur Jain, Dr. Ashwani, Bade Miyan, Chote Miyan. We are here to make a strategy as the result came, and the result was so poor, 10%, and I know our students had worked hard a lot. They really worked hard. We are really in touch, and we are feeling really sad for that. But anyways, life goes on, and we should stand up with a little bit more force, more firm determination, because we have no other choice other than study. So we are here to make a strategy how we should plan our further study. We should not take gap, and we should start preparation as soon as possible. So Dr. Ashwani, please.
Yeah, actually, the thing is ki I have found it over 6 years again and again that all those students who keep on trying, who keep on giving exam, they definitely pass. It's just a matter of 6 months or maximum 1 year, but they definitely pass. Plus, let's say suppose it actually happened with two of my friends also, because I also did my preparation in Gautam Nagar area with MCI students. They were very close to me. My batchmate in AIMS New Delhi was Sarika Palepu. She was an MBBS student from China. And I always found that students who fail, next time when they give exam and they keep on preparing, they get 180, 190, 200 marks.
Yes.
And they get lifelong confidence by those marks. I have seen that failing, at that time they feel sad and all, but out of them, some they do not take gap, they start their preparation with full phase, and when they get 190, 200 marks, they get the confidence for lifelong that now no exam is tough for me, now NEET or INICT is also easy for me, and then they clear that also. So in a way, right now I am very sure that you are thinking that it's not good, but sometimes blessing also comes in disguise.
Definitely.
And if you kept on working, I can guarantee you that if you kept on working, the result will definitely be good. It's just a matter of time. And everything is, all these results are temporary. All the things which your relatives and friends and things people are discussing are saying, this all temporary. When the result will turn into good, their words will also change. So don't take it so seriously and focus on how to come on pace and start the preparation right now.
That's true. Yes, I have seen many students who fail once or twice. It doesn't matter, as you said. But after that, they cleared their FMG. Immediately, they got their PG, desired PG set. I have few students who have done DM.
Wow.
So it's not the means you can think like that. Okay, this is the activation energy you are requiring. After that, you will get whatever you are desiring in your life. So never ever feel depressed. This is a barrier which has come. With this barrier, okay, we will accept, okay, we were hindered by this barrier, but no, we will not stop.
You will not stop.
Okay, so continue your study without wasting time. Again, I'm saying, without wasting time, all the emotions, all the sadness should be put aside and channelize that sadness into firm determination. Okay, this time I will prove. Okay, whosoever has stopped me, because that all students do so much hard work, they deserve. But this time the paper was so tough, means tougher than NEET. Okay, what are the intention of the authority, I don't know, but I will definitely appeal on this platform that to the government that they should seek some guidelines, just like giving keys to the questions.
At least the answer key should be given so that they can verify it. Yeah.
That can be verified. At least the student who knows that I am unable to clear this time, I am having only 149, at least he can start preparation 1 month earlier.
Yes.
So there are so many advantages if they give key of this exam. And if anybody is being questioned every time, I usually think, suppose anybody is asking me question, you are doing cheating, so I should prove myself that I am not, if a thing is possible. So but that definitely this is not beyond our control sometimes. So what is in our control is hard work, and hard work is never go in vain. Is going never. So this was an introduction. Now Chote, tell me that how they can start preparation, how they should move, and yes, previous year questions, NEET questions. Yes, please do focus on that part.
Actually, I want to add one more thing, that I do not understand why there is 1 month delay in the release of result. That only create suspicion, and that only affect their future preparation. And they should definitely give an answer key, and the answer result should come within 1-2 days. That's an OMR seat. Why it is taking 1 month time?
Definitely.
It create a confusion there. So the point is very good. Thank you, sir, for let's discuss the way forward, because many students found out in this exam the same thing which they found out in previous exams, that the pattern is going clinical, and most of the teaching coming from teachers are just one-liner questions, or most of the coaching T&Ds are also just one-liner, and the pattern has changed, but they are not changing. So one very important thing which I felt is that all the students who are going to give exam this time, they should begin their preparation with practicing clinical pattern question.
From where?
From where? One platform is the previous year NEET question, and for 2-3 subjects which are more clinical, you can also practice some INICT question. Let's say some student practice 3 previous year NEET question.
Definitely.
3 previous year NEET, only 900 question are there. Out of those 900, from the clinical subjects, we will get 100-200 question. So one way of getting clinical question is the previous year questions of NEET. Plus, the advantage of doing previous year NEET question is that the questions I have seen in MCI, they come from NEET sometime, from INICT sometime, and again the MCI question is also repeated in NEET sometime.
Definitely. At least topics are repeated.
Topics are definitely repeated.
The same topics are revolving here and there, and as Dr. Ashwani said, that previous year question, from where we should practice, that previous year question is the best, because at least you will be familiar with those topics which are being asked again and again.
Yes.
So rather than wandering here and there searching MLE questions and different questions, better to remain in touch with those questions which are being prepared by same faculties.
Same medical board. Same medical board also.
Yes,
the medical board of preparing NEET and MCI are same. So we have to do the NEET question, and don't waste this starting period in doubt and discussion. If I truly believe it, sir, it's like I can bet on it, that if any student in the next 15 days, if you planned that I have to finish 3-year NEET question and 3-year FMGE, just 3-year questions. So 3-year FMGE means 6 paper.
Yes.
And 3-year NEET means 3 paper. So total 9 paper is there. We have 15-day time.
Yes.
So if in these 15 days, you start your day by the target of doing at least 200 question per day. If you can't do 300 from the paper, at least 200 per day. 200 will take 6 hours around, if you are reading the explanation also. So we can easily do in 15 days, we can do 3 to 5 year NEET and 3-year FMG we can do. If you did it in this 15 days, sir, I am so sure I can bet it with 100% confidence that any student who in this 15 days who finished this NEET and FMG, NEET 3 to 5 year, FMG 3 year, if they finished it right now in the 15 days, I can give it on written that no one will stop you from getting more than 160 mark in your MCI exam. I'm so sure that I can they can come and they can beat me with their slippers or shoes. I'm so sure with that it will happen. But I am saying it again and again, sir. I'm sure you have also heard me saying it previously.
Yes.
You have to do 3-year NEET.
Yeah, definitely.
But the student listen to that and then they think that, oh, I don't have the base, I will not. But the thing is, the question answer are in English only. If you will prepare it right now in the 15-day, for the next 4.5 months, you will be sure that this is the area from which question is coming. These are the main topics.
Definitely.
So that will not let you waste the time. And in the 15 days time, your marks, whatever your marks is coming, it will increase by 15 to 20%. I have this sincere request from my heart that please, 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 don't waste this 15 days, first 15 days, get into the gear, don't listen to anyone, start your day by doing questions and finish 3 to 5 year NEET and 3 year FMG question in this 15 day, and after 15 day, you can tell me what is your confidence level. Definitely your confidence level and marks will increase by 15 to 20% at least. Please follow this request, just a request. As I elder brother, I am requesting you, please do that.
Thank you, Dr. Ashwani. You gave a sincere advice. I will try to little bit modify.
Sure, sir.
Never put stress. Sometimes what happens, just like you gave 15 days deadline, at this time, being a psychiatrist, I would say I will give you little bit relaxation. Not in 15 days. If you could not do, don't be depressed. It may be 20 days. The main concern is that you should be very well acquainted with the trend, with the topics, so that from where you are doing, we are not concerned with that from where you are taking coaching, but at least whenever you will appear in the, you will go in the class, you will know, okay, this teacher is focusing on this. I have read this question. Your interest will increase. That, oh, this question was asked, and he is teaching the same topic. So your interest will increase. When interest is increased, your grasping power will increase. So means at least you should be familiar with these topics and the clinical. One more thing. Many times I have seen that students are saying that no, we are so habitual to read single liner. Okay, I know I can't do clinical. No, dear, you have very good IQ. I know, I have seen, I do remember my, just like Dr. Ashwani said that his batchmate, my batchmate, I will tell you the name, Piyush, Dr. Piyush. He has published so many papers. He has visited more than 4 countries during MD.
Yeah.
No faculty visited.
I have not visited 4 countries till now.
He was also from China. He was my best friend.
Okay.
Even
just
now,
like Sarika was my best friend. Sure, very good.
But I make boys best friend, just like you.
Boys can also be friends. Like.
Yes. Okay. Humor should not be decreased in life. Okay. Humor should always be there.
Yeah.
Okay. Nothing is lost, dear. If we are here, we are enjoying, we are reading, we are spending time with our loved ones. Yes, that is more important than any other thing in our life. Do you accept, sir?
Yeah, definitely. And plus, if you are suppose you are stressed and all, then memory also get affected with you.
Definitely.
And if you are happy, then the short-term memories feel it better to go into long-term, and it's easier for us to remember the things. Plus, one thing is, now you will ask that, sir, how can we be happy during the time of stress when we are seeing that the result is coming 10%? How can we be happy? So the answer is that happiness, I think you know it also, and all the wise people know it and say it. Happiness is not dependent on external situations. Happiness is something of our inner confidence and inner strength. If you understand this point, that whatever you are reading, suppose you are failing one time or someone is failing, did not pass, but whatever we read, the same knowledge will be useful when you are dealing with patients and when you are earning money. So the time which you are investing, it's not getting wasted.
Yeah.
So we can be happy even at the time of stress, thinking that we are growing in our life, we are learning new things, and this knowledge will give me money and respect. So why I am sad while studying? This should be the actual way by which we should look at the books.
Really, Dr. Ashwani, I will definitely say that I do remember when I prepared, then I thought that all the subjects, I used to think like that, the whole subject I'm reading, it's a wastage. But when I'm doing clinical practice, I found that each and every aspect of medicine is being used.
Yes.
And this reflect our knowledge, and patient do understand. At this time, patients are so intelligent. They understand that how much knowledge the doctors have.
Definitely.
So whatever you are investing will be paid in the form of respect, in the form of money. Okay,
and blessings and love. Everywhere.
And
you will get the love and respect. It is there, sir. Many a time I have seen a student thinking that, sir, we are reading that in radiology this X-ray had this snowball sign, and these are the 4 diseases in which this sign is present. What is the use of this? The use is this, that our eye sees what our brain knows. So if you don't know the thing, you will not be able to apply it in the patient, and all these objective question, all these boring notes, every one line has the capacity to save one life and improve one quality of life.
Dr. Ashwani, let me tell you the truth of private practice.
Sure.
You know that suppose a patient of depression came to me, he is having little bit some congestion or chest infection. Sometimes I don't do that because now I am earning a lot from other sources. But I have felt that suppose I don't give him or her medicine of that, sometimes we write, okay, then he will go to the medicine person, and next time he will not come to you because the medicine person will start your antidepressant. Yeah. This is the bitter truth of the private practice.
Yes.
Okay, so when you are doing private practice, you must be familiar all the. Suppose a seizure patient comes to me, I should know the neurological. Otherwise, he will go to the neurologist, and you will find that so many neurologists are prescribing so many psychiatric medication freely. So means whatever you are reading, trust me, it will be used. Remember this.
Yes.
So never ever feel distressed that you are wasting time. Whatever you are investing, dear, it will be used in your PG entrance, first thing, then in practice. To double benefit.
And third benefit is it will be used in treating your relatives, your neighbors whom you don't like that much, but still they will come to bother you again and again, and they will not stop by thinking that, okay, I have taken PSM, so they will not come to me. They think you as a doctor because you are a doctor for the rest of your life. So we have to be prepared for every disease, and this 6-month preparation, 1 year preparation is the one thing which will give you every perspective, and that will make you very comfortable in all the areas. Okay. And
one more announcement.
Sure.
Yes, we are starting Behtareen Bhatia regular batch for FMG online live, in which our esteemed faculty would be there to teach you on live. That will be very interactive session. Means you can ask your doubt, you can remain in touch with the faculties, and being part of DBMCI, I have started early morning motivational section on daily basis. So I will remain in touch, I will motivate you, I will monitor you, what you are doing. Yes, if you have any problem, I will try to solve that. So in that Behtareen Bhatia batch, yes, I would be available for that. So this is being started. One batch is started, and second is going to start. So today's was my first class. You are most welcome in that batch.
The reason why we are willing to make you join this Behtareen Bhatia course is that many students who called me after the exam, they said that the teachers who are teaching in MCI classes, their notes are mostly one-liners, and the questions, I am not taking any name, but the question did not came from their notes. So of course Bhatia teaching was previously more centered towards PG coaching.
Yes.
And all the teachers who are teaching here, they know that, okay, these are the course material for FMG, and they know how to put the clinical part there, because they are putting it for all their NEET and INICT papers.
For a long time.
For a long time. So if you have done coaching from anywhere already, or if you have read it in the MBBS time, then you already have the base. And you can very easily grasp the clinical part which is being integrated through here. Plus, if you don't have the base and you reading it fresh for this 6 months, again, someone who can integrate the clinical part will be the one which will help you in the real exam. If suppose I just taught you one-liner things and did not give you the concept of epidemiology or biostat, then it means that I'm doing cheating, because I'm teaching you something which is not coming in the exam. That's a total wastage of time.
Definitely.
So I think the reason why you should move on to some coaching which is putting clinical part also mixed with the question, that will be a better decision. So you should go forward with that. And sir will definitely be there, not just in words, but in action. Plus I will also be there with you to help you out. And our numbers, phone numbers and everything will be given to you in that motivation session. You can have it right now also. And we can help you in all the ways, whatever you think. As an elder brother, we would definitely like to help you. And he's anyway Bade Miya, so
Chote Miya
also help.
Yeah, definitely. And
we will try to keep you happy also on the journey.
Definitely. This is the main motto, because I have changed my status tagline. I don't know. I will little bit.
Okay.
That's success is defined by happiness.
Wow.
How much you happy, that is success. So when I changed that, I realized that at many times I found that I am sad. Then I thought, happy. Hey, successful.
Yeah.
So remain happy, remain in touch, never ever feel alone. Yes, whatever we can do for you, we will try. Okay, and as Bade Miya, Chote Miya, yes, we will be coming on regular basis. Yes.
Two things came in my mind. First thing is that I became a father recently. My girl child is 9-month-old only. Prisha is her name. So when I think about the future of my child, I never think that she will be a doctor, then I will be happy, or she will be a topper, then I will be happy. If she failed 10 times in 10th exam only, or 5 class only, or 2 class only, it doesn't bother me. If she became a lesbian or anything, it does not bother me. The main thing which I wish for my child is happiness, and this is something which is universal to all the parents. Even your parents, they say to you, they pressurize that, okay, you should clear and all, but their intention is not to pressurize you, but their intention is, they think that when you will clear, you will be happy.
Yeah.
So they are pressurizing you to clear it. That's it. And of course, some social pressure is also coming in their mind, so which they are forwarding it to you, because unconsciously. But their main intention is always to see you happy. So actually, if you are feeling pressure due to any family reasons, or anyone said something, or like this things, expectations and all, you should know the core of the parents. The core of parent is always same. And sir is also father of 2 sweet children, so will agree with me. The core is always just happiness.
Definitely, Dr. Ashwani, I usually say to my students that they are not psychiatrists. They don't know how to convey their message, that how much they love. They don't know, and how they should motivate you. They don't know the exact way. Being a psychiatrist, being a teacher, being a mentor, sir knows, I know that how to remain in touch, and politely, gently we should shape the students. But they know, they have learned from ancient time. Tak, tak, chip, चप्पल जूते and this was a bad
strategy, which is not working.
so they don't know that time is changed, but they know that my father beated me like that and I was improved. So they are thinking like that.
They are thinking like that.
So it's not their fault here. So never ever think that they don't love. They are, mentioning that how much money you have wasted. No, they don't think. Yes, whatever I am doing, I am working since morning to evening only for my children. Not for me. Yes, I am investing my, all the time. For whom? So in the same way, your parents are so mature, they are not disturbed. Sometimes we think that we are mature and our parents are so labile. No dear, they have much more coping mechanism and coping ability. So you should be strong. Your parents make them strong. Okay, Papa, this time I could not do, but I will definitely do it. And then you will feel the smile on their faces that my child is so strong.
Yeah.
That is more than sufficient.
Yeah.
Your score is not determining their happiness. Your firm determination, your smile is determining their happiness. So never ever be disappointed. I have seen many my students, yes, whose parents always support, and some who say something. So
but don't take it seriously. Like, my father is no more with me. He passed away after having 10 years of hemiparesis. But whenever I think that he is near me, suppose, what is the one thing which he will be expecting from me? He would not be expecting six-pack abs from me. He would not be expecting crores of rupees from me. He is just being expecting that I should be happy.
Definitely.
So that's the core expectation. So if you are not being happy, then you are causing bad. Otherwise, failing, passing is just temporary. It will change. And if the smile is there, that will make everyone happy around you, and that will improve your memory also.
Right.
So do keep it there, and that's why sir is giving you daily motivation, so that if sometime we all need some motivation, and even I need some motivation sometimes. So we
together make each other happy. Okay,
Yes.
Not only I will give you something, you will also give me.
Yeah,
Yes,
that is also a good point, sir.
Yes. When I will talk to you, yes, definitely I will feel better that I am talking to my younger brother, sister. Yes, and I could be a part of your journey, and this itself give a pleasure.
Yeah.
So
Plus, one Sairi is there to motivate and to give the strength. Forgive me if my Urdu is not that correct. कि गिरते हैं सह सवार ही मैदान जंग में.
वाह वाह वाह.
वो तिफल क्या गिरेंगे जो घुटनों के बल चला.
अरे वाह वाह.
That means the one who are fighting in the battlefield, they will only fall. Those who are already on their knee, how they can fall?
Definitely.
So the meaning of this Sairi is that you need not to think about the result. You just have to focus your strength and energy in the battle. Go in the battle with a happy mode, with full energy, and never surrender. Never think that because the situation is tough, the result is less, I will fail like that. If you said it right now before fighting, it means you are already on the knee. So don't be on knee. Stand right, be a fighter, and enjoy the fight. Give your 100%. Don't worry about losing the battle or winning it. Enjoy the journey. And as sir was saying that whatever you need, the support, the happiness, the motivation, sir will be coming daily morning to do that.
And Chote will also, I will try to, he is having really hectic schedule. The reason is that my subjects are small and his subject is big, just like his tummy.
Plus it's difficult now, I should work on myself. I am not waking up early morning, so that's why. But I would like to join the sir.
Definitely, we will remain connected.
Yes.
And as we promised, Bade Miyan Chote Miyan, we will be always there. So,
sure.
So take care, best of luck, and we are always there for you. Remain connected, be happy.
If you have anything to say or anything to send, feel free to communicate it with us.
Okay.
Thank you so much.
Thank you.
Bye bye.
Bye.
Khuda Hafiz. Das Vidaniya.